Good evening. My name is Robert Streifer. I'm an associate professor of philosophy and bioethics at UW-Madison. Some of my research focuses explicitly on the ethics of using animals. I'm currently chair of the Letters and Sciences Animal Care and Use Committee, which oversees the Harlow Primate Lab at UW, as well as observational field research on non-human primates. I'm also a member of the All-Campus Animal Care and Use Committee, which sets campus-wide policy on the use of animals at UW. Although I am involved in the animal program in these ways, I don't use animals in my own research. I attended the Health and Human Needs Subcommittee meeting. The first argument was one made by a UW AIDS researcher who opposed the resolution. He said, quote, "The search for an AIDS vaccine relies on research with non-human primates. Opposition to non-human primate research is therefore opposition to AIDS research, full stop." This person was absolutely right, of course, that it's important to be aware of the implications of restricting research. But I don't think it's plausible to describe those who believe that it's unethical to do research on non-human primates as being opposed to AIDS research. Consider an analogy. We wouldn't describe someone opposed to research in which human beings were intentionally infected with HIV as being opposed to AIDS research, even though allowing such research would undoubtedly speed up the search for an AIDS vaccine and save lives. Everyone should acknowledge that there are ethical limits to research, and while we may debate where those limits are, no one should be characterized as anti-research merely for advocating their view. In the end, what we all want to support is ethical research, and what we all want to oppose is unethical research. So while it is important to understand the implications that restrictions on research would have, the mere fact that the board might want to be supportive of a particular kind of research in which NHPs, non-human primates, are used, that mere fact does not mean that the board must specifically also endorse research on non-human primates.
I was reminded today when I was at work, I'm a physical therapist at UW Hospital, that I should probably come and testify myself as a resident of this county. I think I bring a unique perspective because I work in healthcare and I can see the advantages of research. However, I'm reminded back to my undergrad days when I took microbiology and did my first seminar on ethics, and it was on animal research, and I saw very disturbing images of pigs being burned to study how to further care for burn patients in humans, and baboons being inflicted with head injuries to show how we can improve the treatment of head injured patients. I did some calculations. I've been a PT for almost 20 years, so I've seen at least 40,000 patients, often with neurological conditions. I've seen the effects of HIV, Parkinson's disease, Alzheimer's disease, diabetes, spinal cord injured patients. But what I keep reminding myself of is I think that at times the research that we feel as humans is necessary may not be necessary to give the best care to our patients. Anyone who took undergrad, I'm sure we all had basic psychology classes, and I think you can all remember the studies on the monkeys that were raised in cages and how that affected them psychologically for the rest of their lives. And I have no doubt that the people in this room that do the animal research believe very strongly in what they do and what they're doing to improve the lives of their patients. But I have to say, in seeing the improvements that we've made to date in treatment of all the diagnoses I've just listed, that if we needed to end what we do as far as animal research today is happening, I feel that we can do amazingly well with the patients that we see.
Resolution 35, is there a motion on resolution 35? Supervisor Levin?
I'd like to move indefinite postponement of resolution 35 and sub 1 in committee.
All right, that's motion's not in order because there has to be a motion on something before you can postpone it or indefinitely postpone it. So, is there a motion on resolution 35? Someone has to move resolution 35 or the motion it just dies for a lack of a motion.
just dies, never to come up again?
Well, someone has to move it. Yeah, I mean, it's not like it comes before us having been moved. So, that would be the case. If there's no motion, then there is no motion before this committee, and there's no second, so.
So what happened? You asked what happened. Essentially, no motion was made, and it had the effect of being a postponement in committee, but a temporary postponement. Now, we did have one member absent today. Chair McDonald made the point when Supervisor Levin moved for indefinite postponement in committee, and Chair McDonald ruled that out of order, indicating that indefinite postponement in committee can only be made as a way of deliberating on a motion to approve, deny, or make no recommendation. And therefore, by not making one of those motions, the committee avoided the action Supervisor Levin appeared to.